All right, go for it.
Okay, when somebody is immunocompromised, like how do you know probiotics or things that are normally good for other people? How do you know whether it's going to trigger you or if it's going to be good for you?
Yeah, that's a good question. And I guess it kind of depends on the level of immune compromise. So the question was, if someone's immunocompromised, how do we know compromised? How do we know if a strategy will be good for that person or cause that person to react negatively? That's a good question, and I guess the answer is it depends on how we define immunocompromised, right? So there's probably a spectrum here. So on this side, we could say these people are healthy, and that's defined by no abnormalities on labs or diagnostics regarding immunity. Okay, so there's one. Then we could say there's this group, and this would be kind of like functionally compromised or in process towards compromised, I guess, or suboptimal. So, they don't fit, there's no diagnostic criteria for compromise on labs or diagnostics, but they might have a uh, diagnosis of, say, an autoimmune disease or persistent infection or something that in conventional medicine isn't necessarily overtly immune compromised, but obviously this person is dealing with something that a healthy person is not. So there's some inefficiency in their immune system, right? And then the last case, at least that we'll draw today, there's probably other shades in here, but then we'll say, diagnosed immune compromise, immunocompromise. And so these people would be people with, say, lab low white blood cell counts. Maybe there's cancer, maybe there's HIV, maybe there's an autoimmune process that is such that their immune counts are lab low, or more more in-depth immune testing like CD4 and CD8 ratios are lab low, other things like that. And so, if we have these different groups, well, then in the green, we would suspect to have the least amount of response to the strategy. And as we go across the spectrum, orange to red, the susceptibility or probability that someone has a an adverse response increases as you go orange to red. Does that mean they will? No, but again, if you have true immune compromise, like diagnosed immune compromise, that's a greater risk because those people, we live in a world where vaccines are the savior for everything, right? But when someone's immune compromised or really sick, when even mainstream says no vaccines, you know, talk to your doctor before you take a vaccine or whatever. You know, that's that's an immune compromise level where if they're not going to give you their holy grail, then that's pretty serious. That's how I look at it, at least. And so, will a probiotic impact someone with diagnosed immune compromise? Possibly, if that immune compromise includes, you know, leaky gut, as it would be called, or hyperpermeability in the GI tract. Because as I've shown in other videos, you might not even be diagnosed immune compromised. You could be in the orange area, and still take a probiotic and react to it negatively. And if that happens, as we've talked about in previous videos, then that suggests that the gut barrier integrity is subpar, and the probiotics that are part of a normal healthy gut environment are getting or passing through the gut barrier into a part of the body where they shouldn't be and driving an immune reaction to them. That makes sense?
Yeah, so kind of you you just kind of
You
try it
don't
out.
know. Yeah, yeah.
Okay.
So if someone, again, if the easy kind of marker to look at for the purposes of this video would be if you've got a white blood cell count in normal range, then you wouldn't be considered immune compromised in the medical doctor's office. So you'd probably fall in the orange area.